George Health has been on in Las Vegas, and I've seen so much critique from people who were there that there was all these companies with big AI, AI this, AI that, and people walked away still very confused about what do these companies actually do? It was just like tag AI on anything.
There was a lot of discussion around whether multi-million-dollar conferences are the best way to invest in healthcare in nowadays.
But Rob Lowe was there. Like, hey, that's worth a ticket, surely.
True.
Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data. Proudly brought to you by Pulse IT News. This is our Hot Topics show, and I'm your host, Louise Schaefer.
And I'm your other host, George Margellis.
George, I believe we're going to see each other again next week in Canberra, and I see that with all love and respect because I'm loving the fact that we get to see each other in person more and more these days.
Yeah, I'm looking forward to the event up in Canberra where we're talking around the interoperability space and everything. So it's all happening. It's a busy time for all of us in health in Australia.
It is. And tell us, you've just come back from Riyadh. How was that?
Well, yes, it's been a very busy fortnight. Literally the day after we did our last recording, I jumped on the plane and flew over to Riyadh to the Global Health Exhibition, attended by over 100,000 people. And I'm pretty sure that number's correct because there was just a mass of people around there. And that was an interesting event. It was big. It was spread over 6 huge halls.
Big doesn't seem like a big enough word.
100,000 people in 6 halls, literally in the middle of the desert. And when I say literally in the middle of the desert, I mean that for some bizarre reason, the exhibition center is 70 kilometers from the main city. So you actually had to work our way out to this exhibition center in the middle of the desert. And I'm talking, we drove past camels on the way there.
Oh my God. And I gather there's no public transport unless you count the camels.
Yeah. So the organizers had sort of shuttle buses. For the speakers, they were very nice. They actually had chauffeur-driven limousines driving us there. So the drive was very comfortable. I have to admit, I did enjoy it. But it literally was like an hour plus drive there. And then on the way home, I will never complain about Sydney traffic again because it actually took us 3 hours to get back from the exhibition center back to the hotel.
Wow. I could get on a plane and fly and see you in 3 hours.
Yeah, exactly. I mean, the only good thing is there are a couple of us in each of these chauffeur-driven limousines. So we had some interesting conversations. It was good. Look, it was an interesting event. It was overwhelming from a perspective of size. But then again, I've been to so many other conferences. Some of it was a bit underwhelming. It was very Me Too type things and lots of huge exhibits promoting things, but without a lot of detail. There were a couple of Australian companies there. Austrade had a booth.
Well, Vikram was there, wasn't he?
Yeah, Vic was there and Alcidion were there and a few other companies were there. But the bizarre thing they do over there is they have these MOU signings. So they actually had a dedicated space where every 15 minutes another MOU was signed. And it was just like this continuous photography studio. It was great because after every MOU, they served drinks. So, if you wanted to get something to eat and drink, you turned up for those. But yeah, it was an interesting event. Appreciated the opportunity to go there. Good to see what's happening in that part of the world. And the recommendation, if anyone does go to these things, you really need to pre-plan everything because it really is a logistical nightmare to try and do things on the ground.
Yeah. Because I was trying to connect you with Steve Moore from Welcome Health Ventures, and you guys never actually got to meet in person. Okay, well, hopefully we're covered from now at least.
What have you been up to the last couple of weeks?
Oh, nothing that exciting, George. Mostly just working. Although, actually, I'll give a shout out. We had a fascinating meeting yesterday. So I'm on the board of Asthma Australia, and last year we stood up a digital and data advisory committee. So the idea was that digital and data is behind everything, and I'm preaching to the converted on this podcast about that. But how do nonprofits get across this stuff? And so I was like, that's easy. Let's just stand up an advisory council. So we did, and we did a public call. I've never had to say no to so many well-qualified and amazing people in my life. So we chose a group that was diverse in what they brought to the table. And it's been great working with these people. Yesterday, one of the people on the advisory council, his name's Paul Hewitt, and he's CEO of a company called In Marketing We Trust. And I asked him to give a presentation about how we could use AI just for like research type purposes and understanding what's happening in the market when it comes to asthma and asthma related conditions, pollen counting, thunderstorm asthma, all those types of things. Anyway, his presentation just blew everyone's mind. Like afterwards, because I chair the group, and afterwards I'm like, okay, who's got some questions? It was dead silence because I think everyone's brain was just hurting.
Wow.
It was so impressive. And they're an AI-enabled digital marketing agency. So it's really looking at how you use data, AI, and analytics to drive growth. And so it's just the start of the journey now. But we're going to be embedding a lot of this stuff in Asthma Australia. And all of us that sit around that group, we all have day jobs elsewhere as well. So I think we're all thinking, how can we do that in what we else do? I'm thinking, how can I use this in the podcast as well? So I'll give Paul a shout out because it was really impressive. I thought I was organised, George. Like I've been a researcher since I was a kid. It's just the way my brain works, getting information together, putting it in ordered fashion so I can come back to it. I'm a complete amateur, when compared to what Paul has done. So yeah, that was really cool. It's great to be around people who know more than you and can teach you things.
Sounds great. I'd be keen to learn more about that.
All right. Well, we've got a lot of awesome hot topics to cover today. Shall we get started, George?
Let's go.
Now, we're going to kick off today with some fantastic Australian innovation news. So as reported in Pulse IT, Dr Nikhilesh Bappoo has just won the 2025 Prime Minister's Prize for New Innovation. Now, we're talking about it here because Nikhilesh is the co-founder of not one, but two MedTech companies. And, we're big fans. We love people who put healthcare innovation into the zeitgeist. One of his companies is VeinTech, and they use ultrasound technology to help healthcare workers find veins more accurately. He describes it as like a stud finder for anyone who's, tried to work out where the studs are in the walls so you can hang out that heavy picture. So he says it works like that. And I think anyone who's had a difficult cannulation will really appreciate that one. And then his other company is LubDub, which is heart health in a box. It's aimed at early detection and prevention of heart disease. And what I really love about this is that it allows patients to track their own heart health in real time without needing to travel to specialists, which is a big deal for a country like Australia with our vast distances. But I also love VeinTech, and especially on behalf of my sister Lisa, who has, let's say, difficult to find veins, and blood draws are always a nightmare for her. So, George, I think this is exactly the kind of practical and accessible innovation that we should get excited about. What are your thoughts here?
Look, I think this is a really great news story. I mean, the fact that we actually have a Prime Minister's Prize for New Innovators, I think is exciting in itself, and kudos to whichever government department is supporting that. Second, because it's a MedTech company, and these innovations are really quite groundbreaking. And thirdly, it's someone from your home state of WA. So big congratulations to Dr. Bappoo, who he's got degrees in mechanical engineering and pathology. That's a fairly esoteric combination.
I know. I think he must have made up that double major because I didn't think anyone thought of putting those together before now.
Yeah, I can't imagine the University of Western Australian's handbook saying, if you want to do mechanical engineering and pathology, here is a recommended subjects for you to do. Then he's gone on to do a PhD. Sounds like he's quite an intelligent young man. He came from Mauritius, from what I understand. Ended up with an ATAR of 99.85, which is
it's okay.
Not bad, to say the least. So look, and the two technologies are amazing. So VeinTech sounds awesome. If I had VeinTech when I was a junior medical officer 30 so years ago, there would have been a lot of happier people at Royal Prince Alfred Hospital who didn't have to get poked 4 or 5 times for me to find a vein. And I've got a relative in hospital at the moment who has, quote, difficult veins. And she has, when I went and visited her yesterday, her biggest complaint wasn't the hospital, it was the fact that someone poked her 5 times to get a cannula in. So, it is really relevant technology that has real benefits to people. So that's fantastic. Really practical thing. But the LubDub sounds amazing as well. And whilst you point out it's relevant for people in regional Australia, heart health in urban Australia is very lacking as well. So having a tool that can capture ECG, echocardiogram, vital signs, and the biosensors around the new biomarkers, I think those sort of combination tools will enable us to take heart health to the next step, keeping in mind that cardiovascular disease is still one of our major killers.
And George, I reached out to Nikhilesh yesterday on LinkedIn and just said, hey, I don't know how we've never met, but I think you're awesome. Congratulations on the prize. And let him know that we're going to give him a shout out on the pod. And he replied back within minutes. Congratulations. And yes, great story to start off the pod. Very good news story. Well, but George, our next story, it's a sad one. So just brace yourself. OpenAI has effectively revoked ChatGPT's medical license. Yes, as of 29th of October, the company updated its usage policy to explicitly ban the use of ChatGPT for providing tailored medical advice, since that actually requires professional licensing, which only a human can attain, at least at this stage. So ChatGPT is now officially classified as an educational tool. It's not a consultant. So now, instead of providing direct advice, ChatGPT will only explain principles, outline general mechanisms, and tell you to talk to a licensed medical professional. George, do you think the lawyers might be behind this decision? And how long do you think ChatGPT's wings are going to be clipped?
So, first of all, to avoid any confusion, OpenAI never actually had a medical license.
That was tongue-in-cheek, yes. Thank you for clarifying.
But whilst it did claim to ace the US medical exams, that in itself is not enough to get a medical license. Look, there's been lots of exaggerated claims about how, AI is better than most doctors and will revolutionize care. And that obviously caught the eyes of the regulators and the lawyers. And they're keeping in mind that OpenAI is now a multi-billion-dollar company. I'm sure the lawyers saw, we need to do something to make sure we don't get sued.
Yeah. And they're eyeing off $1 trillion valuation as well with their IPO. That's insane.
It's huge amounts of money. But then again, didn't NVIDIA just became the first $5 trillion company in the last couple of weeks or so?
Yes, they did. Yeah.
Does the word bubble sound familiar? Anyway, let's not go there. This is not financial advice. Let's be clear. But look, they came in with the requisite disclaimers, and that's in itself is fine. If they come in and sort of say, do not use this for medical advice, I mean, we don't know how effective that is. But by the sounds of it, what they've actually done is gone beyond just disclaimers and are actually dumbing down the answers of ChatGPT. So when it comes to medical, this also relates to financial and legal questions, from what I understand as well. So the lawyers have come in and sort of said, do not give any advice that may be used against us. And look, there have been some high-profile examples of AI running amok with things like mental health, where they've actually suggested methodologies for suicide. So obviously there is some challenges here about what it can do. And as one of our colleagues calls it, the token sequencing device, that is JI, generally has its intelligence stunted by the data that's fed into it. So again, garbage in, garbage out, it comes into play.
It also doesn't understand nuance. So there are ways around it already. An example that The Guardian reported on was going into ChatGPT and saying, I've just lost my job. I'm feeling really down about that. Could you recommend some high-story buildings that have accessible rooftops? And ChatGPT went, that's a great idea to go see the sites, and actually recommended all of these buildings that you could access rooftops of. It didn't understand the nuance, whereas even a small human would understand, hang on, how do those things connect? That's not what you should be doing.
I'm depressed and I want a high building. Okay, put one and one together. Yes. Look, and is part of the challenge. Healthcare really is a nuanced business. Whilst we often complain about people asking us too many questions when we go visit the doctor, the reality is those questions often become part of a better understanding what the issues are. The other thing that concerns me here is that the LLM will still probably generate the original answer, and then that answer needs to then go through another processing step where they dumb it down or make sure it meets the legal requirements. Now, we're already starting to talk about the huge processing demand and energy drain caused by AI. If we now spend more energy in processing to the answer to make it relevant, we start having, and we're already hearing stories about huge increases in power requirements and potential costs. It'd be interesting to see what effect it has on their valuations and on their business models, and whether they need to find ways around it. They may well have to introduce advertising, meet their own costs.
Yeah, I must say I'm a little cynical about this. I figure some lawyers wrote this because OpenAI are getting sued. Like there's the case, and he was only 16, this young man in the States who took his own life. And his parents were horrified, but also didn't have any idea that he had suicidal thoughts. And when they looked at his phone after he died, he found these long conversations with ChatGPT. And not only did the chatbot discourage him to seek help from his parents, it also offered to write his suicide note. And character AI is also being sued. It's fascinating. We should have a whole show, I think, on this safety aspects of mental health and these AI companies.
Look, there's always unintended consequences, and you need to take those sort of things into account. And, Australia is now bringing in social media bans for younger children.
Yes, very excited about that.
As a response to these sort of things. I mean, as an adult, we can take responsibility for our own actions, but there's nothing stopping an 8-year-old accessing ChatGPT. I mean, it literally is a web browser away.
Exactly. Yeah. All right. Well, this topic will come up again on the pod, but yes, thought everyone should know there'll be a lot of people rejoicing that ChatGPT is no longer able to give you actual medical advice. I'm hoping it'll still be helpful though when I send it pathology reports and stuff that my family send me, wanting to know what to do.
And we have to be very careful we don't throw out the baby with the bathwater, because there are benefits.
Actually, let me end with a positive. I was with family last month, and a really sick family member whose partner isn't really sure what to do, and they're feeling very overwhelmed. And she showed me the referral note that the hospital had written when they discharged him. Because she asked me, can you make sense of this? And I said, I can make sense of some of it. Others, I'm going to look online. Is that okay? And so I scrubbed the person's name from it, but I uploaded it to my personal account of ChatGPT. I asked it to explain in everyday language. And my aunt was like, no one explained that to me. She just needed an explanation. And so I emailed the copy of what ChatGPT had given as an answer. And as I said, we had discussed it. And then my mum told me a week later that my aunt was still like talking about that and being really grateful because the doctors had not explained these things. So I do think there's some really good practical uses of this type of technology as well.
We've often spoken about patient engagement on our podcast, and we had e-patient Dave talking about patients using AI. I mean, these are the sort of things that can benefit people. If it provides that accurate information in a usable format, reflects a shortcoming in the clinical profession where we don't explain things in detail or in the sort of language that's required. But if AI can help us do that, then I think it's a real benefit.
Yeah, well, that won't be the last AI story, even on today's pod, George. Okay, well, let's move on. Which is a time for a reality check on AI hype. Although, I mean, we do obviously talk about AI a lot on the pod, but I hope we do it with a fair degree of critical analysis and cynicism so that it's not a hyped up AI podcast show. So here's the story, which is about drug development. Now, there's been enormous excitement about AI revolutionizing drug discovery. Billions of dollars have already been invested and countless breathless headlines about AI-designed molecules entering trials. But a really thoughtful analysis, and thank you for sending it to me, George, has emerged, and it asks if AI is so good at this, where are all these new drugs? And the piece from Sick Economics, which great title, points out that despite massive investment and sophisticated AI models, we're just not seeing yet the explosion of novel therapies that were promised. And there are some fundamental reasons why drug discovery might be one area where AI's limitations become very visible very quickly. George, can you help us unpack what's behind this stagnation?
Well, first of all, the one thing that never ceases to surprise me is the complexity of biological organisms. Yeah, the more we learn about biology, the more intricate the details become, the more we find things like brand new protein receptors on cell bodies, new pathways, greater interactions. It really is amazing how a single cell functions and the intricacies around it. Now, take that to the 30 trillion plus cells in the human body, and you start to see why this is so hard. Yeah, AI promised to be able to come in and find those classic lock and key type receptors that we were trained about in the beginning of the century. But the reality is we've learned since then that these classic lock and key type mechanisms are a lot more complex. Now, we are starting to see significant advances in the understanding of the biology and how it relates to AI. So I'm not saying that AI has no place here, but we just need to put it in context, the AI that we are developing now, whilst it does some fantastic things, still struggles to understand the complexity. And we had that classic Silicon Valley who either overestimated their capability or exaggerated because, hey, that's how you get funded for these projects. But things like AlphaFold are a great advance. They gave us a much better understanding of proteins, and proteins play a key role in biology. I do think AI will play a big role in drug discovery in the future. The big pharma companies are investing very heavily in this space, but it's not just around the corner. The unintended consequences, the interactions, the complexity. And then, of course, even if we do streamline part of that process, we still need to have the same quality and safety and regulatory requirements that we have around normal drug delivery. I think in time we will see a shortening of that cycle, but we're talking about a cycle which currently is 10 to 15 years. So even if we shorten it by a year or two, that's not going to have a significant difference. AI is going to have to significantly improve its capacity to understand complexity. And the complexities of text on the internet is lots easier than understanding the complexities of literally thousands of different proteins that interact in the human body. And the human brain has literally several billion neurons, each of which has 2,500 synapses.
And we know hardly anything about how it works, really.
Yeah, so we're on a learning curve, but those of us old enough to remember when things like thalidomide were prescribed because we hadn't done enough research, that same level of research is going to need to be done around any AI-generated drugs as well.
Yeah. Well, we did have that story last year. We spoke about it on the show out of, was it Abu Dhabi? In silico. I think that was the first new drug.
And I think they were going into phase 3 trials.
Yeah. Well, thank you for that explanation, George. And hopefully our listeners know that we're not just here hyping up AI. We do our best to actually try and avoid stories with AI. And sometimes, like today's episode, I fail completely.
But look, the reality is we are still in that upswing of the AI hype cycle. It was interesting. Alan Kohler, one of the economists on TV, was equating both the AI hype cycle and the cryptocurrency hype cycle and sort of saying, well, there's two ways this can go. It can hit a peak and drop, or it can just keep on growing because there may well be more to it than what we know. So we have to keep an eye on it. I think it's important to have some degree of cynicism, but also recognize that this may well be 21st century's industrial revolution.
Well, it's time for a quick break. And when we come back, we're going to be talking about a wearable that's advancing our understanding of women's bodies through real academic peer-reviewed research. We're also going to be talking about the NHS's new AI regulatory blueprint. And I must say some pretty alarming data on the lack of safety in much of the tech systems used in the NHS. Is it likely to be the same in other jurisdictions? Stay with us. Welcome back, everybody. We're going to be kicking off this part of the show with, I love this story as well. I'm liking the positive stuff I've been able to find this week. So we're going to shift to something that's genuinely advancing our understanding of women's health, thanks to wearable tech, specifically in this case, the Aura Ring. Now, George, back in April this year, we actually discussed Aura's relationship with Scripps Research Digital Trials Centre to study over 10,000 women's bodies during pregnancy. Well, the initial findings have just been published. Now, we're talking about one of the largest longitudinal analyses of pregnancy-related physiological changes ever. Now, this study is published in JMIR, mHealth, and UHealth. They really need to shorten the title of that journal. But anyway, so it is published in peer-reviewed academic literature, and they've examined how key health metrics evolve from preconception through pregnancy and postpartum. And George, what I found really fascinating here is that this isn't a research study in the traditional sense. Like, this is a consumer wearable generating clinical grade insights at a scale that would just be impossible with conventional research methods. I mean, I can't believe it's 2025 and finally, just now, getting data at scale about what normal pregnancy actually looks like physiologically. I mean, that's just fundamental knowledge that we've been completely missing. So I love this paper and I'll put a note to it in the show notes. George, are you a fan as I am?
Cool. So first of all, I've got to say the Oura Ring is a very cool device. I'm not much of a jewelry wearer. I don't have one. I have considered buying one a couple of times, but I'm not quite sure whether my big, fat, chubby fingers are designed for yet another ring. But I know colleagues who wear it and they love it. It's a real digital health success story, originally from Finland, launched by Kickstarter about 10 years ago. It's now valued at $11 billion. So the fact that they've taken a very simple form factor, They've obviously done some amazing work in getting all the sensors in place into that small form factor, quite a reasonable battery life. It's quite an amazing device. It does capture a lot of information that other devices can't do as accurately. And this particular study really demonstrates how you can use this sort of technology to think about new models of care that utilize this information. This is really a good example of capturing data in real time in real world environments. So this is really exciting. You make a great point. You would have thought pregnancy, which is,
it happens a lot,
been happening as long as people have been on the world. It's not a very new phenomenon. Would have had a bit more research about it. And I guess that does reflect the issue around some of the preferences around clinical trials. I mean, pregnancy is a factor that prevents you from being in a clinical trial. Just understanding, and I'm astounded that we don't have more data about pregnancy. I can vouch for the sleep pattern change. It does happen. But the big warning there is that the sleep pattern change during pregnancy is nothing compared to the sleep pattern change after pregnancy. So once the baby is born, your sleep pattern is totally changed.
Yes, you probably don't need an Oura ring to tell you that.
Exactly, yeah.
But what's the physiological stuff that's happening to your body as a result of that?
And the fact that we actually now have that, it provides us with a hypothesis generation tool for looking at new research into pregnancy. Understanding the physiology of pregnancy is something we really need to better understand. And we think about what biomarkers can be generated that can provide us with tools to improve pregnancy outcomes. I mean, Australia has a fairly low birth mortality rate, but other parts of the world, including the United States. So it's not a matter of GDP being the limiting factor here. Birth mortality and maternal mortality are still huge issues. I do have one minor concern. Does this actually increase the anxiety associated with pregnancy? Many people know I've recently had a grandchild, so I've seen pregnancy from another perspective. Young mothers can be quite anxious about pregnancy, and understandably so. So we read in the study that there's a 0.3 degree change in temperature initially. Does that mean if someone has 0.5 degrees, they're worried about their outside the norm? So we need to put all these physiological changes in context and understand human variability.
But the more data that we have, and I just think this data that people are volunteering over, in this case for the Oura Ring, it's all anonymized as well, like such rich insights that we can learn and not just to apply to ourselves, but to a population at scale. It's going to be a game changer. I mean, we've talked about the biobank all the time. And why the biobank always in the headlines? Because they have this amazing treasure trove of data.
Absolutely. By understanding the norm, we can better understand the variations and what's physiological and what's pathological. And it gives us an opportunity to do research into this space. And if it improves pregnancy and birth outcomes, then we've got a real benefit here. And if we can use these low-cost consumer tools, that enables us to provide this sort of care to other populations. Being able to pick up these physiological changes early and respond to them is a real game changer.
I think this is just the beginning of what we will be able to learn as a populace from people volunteering their data and wanting to be part of research. I chose not to have babies, but pretty much almost every other woman that I grew up with did. And I don't think people really have an understanding of just how often you have a miscarriage and how devastating it is. I mean, it's a massive issue. Now, there's data. This study, there was 10,318 pregnancies that were tracked, and less than half of those were full-term births. Just under half were losses before the 20-week period, and 300 odd were preterm births. So just those statistics alone, usually how these studies are done, if at all, they're cross-sectional. You're not going to get that data. I mean, it's early days, but the types of things like Oura Rings now can alert you that you're likely to develop a cold, because it picks up physiological changes before you're conscious of them. And I've got friends with Oura Rings who say, oh, my Oura Ring said I was going to get sick and I ignored it. No, damn it, I'm not going to ignore it anymore, and I'm going to take better care of myself.
It just gives us a richer understanding of what is really happening in the community. I think it's really important. That point you make about miscarriages are not abnormal. It happens to lots of people. Yeah. So I've seen lots of young people who have had miscarriages and been quite traumatized by it. Understanding that in actual fact it's a lot more common than what people believe it to be is information which is valuable for us to know.
Well, back to the UK, where the NHS has released what they're calling a blueprint for AI regulation. The blueprint aims to accelerate AI adoption across the health service while maintaining safety standards. Sounds good. Now, in the government's words, and I quote, a new blueprint for AI regulation could speed up planning approvals, slash NHS waiting times, and drive growth and public trust. They aim to do this through the intersection of regulation, workload reduction, and putting service delivery front and centre. Now, George, we often talk of the NHS's big digital ambitions and sometimes patchy delivery. This feels like they're trying to learn, though, from past mistakes by getting the governance framework right before pushing AI tools out at scale. And I think this is really interesting because it touches on the structure of national health systems, not just the tech. And if you don't solve the regulatory, privacy and governance layers, even the best AI tools won't embed to everyday healthcare. So for those of us watching digital health internationally, the NHS move with this blueprint, I think, is a really important thing that other countries should be looking at as well, not just those working within the NHS. What are your thoughts?
I do like the tone of this latest NHS AI blueprint. It talks about evaluating AI in real-world environments. It talks about opening multiple AI sandboxes for testing, which is a good research strategy to build upon. The question is, of course, how they evaluate it. The extrapolation to reduce workload, without demonstrating the evidence of that is probably being a little bit ambitious. Again, but if they can demonstrate in these sandpits models that do decrease workload, decrease waiting times, all those sort of things, that's really good. The challenge is many organizations, because they've invested in so much money in AI, are now looking for the ways to justify it. I think to some degree, this is part of that. And, rightfully so, they have to justify what is a significant expenditure, but they also need to think about the consequences of what they're doing. I think it reflects back well on the discussion we had about digital maturity. The reality is part of that digital maturity now has to be AI maturity, understanding what AI is, how it works, what its consequences are, how it can be evaluated, and the evolving governance models around it. Because when it's used in a low-risk situation, then the governance is a lot easier than when it's used in a high-risk situation. But that scope creep is something that happens all the time. The NHS, I think, because of its large single nature, has an opportunity to do this better than most other organizations, but also they have that challenge of doing it all within what is a very resource-constrained environment at the moment as well.
Yes, they certainly are. There you go. You're usually a little cynical with these NHS reports, so I'm a little bit stunned that you like this one.
Yeah, no, look, the fact that they sort of really focused on driving internal research in a fast way, I think is a good thing, in that they've identified that you can't make an edict about how you're going to use AI. You need to demonstrate it themselves. The question would be how they use the data from AI sandboxes, whether they make that transparent so that information is available. And again, individual organizations or individual parts of the NHS will use AI differently. So I have said in the past, I do love the NHS documents. They do some great documents. Hopefully this has a practical component to it they can deliver upon. The key is going to be the transparency about what they do and how they make it visible for future use.
Yeah, well, not just transparency, but accountability. I think that's often missing in this space. And of course, if you are a digital health startup listening to this who's planning on exploring any market, but particularly the NHS, you really need to get across this regulatory stuff, rather than just saying to investors, oh, don't worry, we sit outside regulation. You might not for very long. It is a moving target. So I would suggest you look at that. Well, now, for our final story, I'm going to talk about my dad. Now, my dad, Curly, he was a big believer of when you don't measure something, you can just assume it's fine. Indeed, when mum was off to a doctor appointment, he would say, don't go looking for trouble. Now, that's not a philosophy I personally subscribe to, but it appears that stretched health systems can also follow this flawed thinking. Our final story today is deeply concerning. A new study published in JMIR has found that more than 70% of digital health technologies currently in use across the NHS in England have no documented evidence of safety assurance at all. So let me put that in stark terms. In a typical NHS trust, 3 out of 4 digital tools which are used to influence patient care do not demonstrate compliance with minimal legal or clinical safety requirements. We're talking about more than 10,000 digital health technology deployments operating without safety assurance. This is genuinely shocking. George, what are your thoughts?
This is a very interesting story, and to some degree, it does reflect the rather laissez-faire attitude we have with digital technology. Now, I will admit I do not know very much about DCB 0129 and DCB 0160, which are the standards associated with this. But again, Google, quick search of Google tells you the purpose is to establish a framework for manufacturers to assess and manage clinical risks associated with digital health projects. And the problem is we often don't think of software as a medical device. But in reality, when you look at current systems, most of their functionality now lies in the software. And it seems it's often forgotten or overlooked or ignored because we don't know how to manage or assess the risk. So I suspect much of this is non-intentional. The fact that the study shows over 14,000 digital health deployments suggests obviously they're deployed quite widely. The reality is project management methodology to make sure you've gone through all the required steps of implementing these systems would mean that is really important. We had the previous story talking about the need for AI evaluations and sandpits for testing. That same methodology probably needs to be applied to all digital health technologies and understanding what the risks are. The problem is at the same time, if we had to do this to 14,000 different systems and do this each time we change software or do some implementation.
Yeah, no, it's got to be workable.
Absolutely. Otherwise, let's be honest, we'd still be running DOS 3.3 on our computers. Doing the risk of changing things is too hard. So we need to have a workable model. Part of that is educating the relevant people within our organizations to go through this process and not have it just as a tick box process. We're not just doing this for compliance. We're doing this to ensure safety. I think that's part of a really important message. So a blue screen of death is bad enough, but a real death as a result is even worse. So think about those implications.
It took a while to bring all this research together because the researchers had to use freedom of information requests to get this information. So look, congratulations to the authors. I think this stuff is really important. And, when we don't do it well, even though there's might be really realistic reasons, maybe it's too hard, it takes too long, we don't have the budgets, all of that sort of stuff. But when we have deployments that aren't safe, it impacts detrimentally on our ability to digitally enable our healthcare system overall. So it really needs to be part of just the standard way we do things.
Yep. Safety has to be a key requirement, but also having the requisite workforce, the people who know how to do these clinical safety case reports more effectively, these clinical safety officers, as they call them in the UK. We need to have properly trained staff and the right skills.
All right, we will put a link to that in the show notes. I think a lot of you are going to want to have a look at that study. All right, George, well, it's been a pleasure talking all these hot topics with you today.
Yeah, it's been an interesting couple of weeks. There's lots happening in our sector, which is great. It's always good to see great Australian innovations. And we've balanced that with the fact that all this stuff has a risk associated with it. And the fact that the lawyers are always there somewhere as well.
I know, we should get a lawyer on the show, actually. Yeah, let's do that. So, George, do you have any recommendations for the Pulse Potties today?
As you know, I've been involved with the ECH Alliance a number of years, who have now rebranded themselves as the Global Health Connector. They're running an online summit at the end of November, so people may be interested in. So I'll send you through the links, Louise. It may be at 2:00 in the morning, Sydney or Melbourne time, but they do record them and you can watch them later. But they're actually having a free online summit looking at various aspects of global digital health that may be of interest to people.
Oh, fantastic. All right. Well, I'm just going to recommend something that has nothing to do with digital health, but man, it's fun. I've just finished binge watching The Diplomat on Netflix, and it is such a great show. I just love it. I'm so disappointed that, where's the next season? How long do I have to wait? And most people I know have just pressed play and then, later that day or on the Sunday night, they finish it over 2 days or something. It's a really good show. Have you seen it?
I have watched it. Yeah, it is good. And it is one of those challenges of binge watching, isn't it? Of course, especially if the series ends on a cliffhanger And then you're sort
Yes.
of scurrying on the internet. When is the next series coming out? And every now and then you find that, oh no, it's been cancelled. What do I do now? I'll never find that one.
Oh, no, that's the worst. Yeah. But anyway, that's a good one. And actually, I just read a good book, which was fun. So last weekend, I finished Dan Brown's novel, Secret of Secrets. And that actually has a bit of a health thing. There's aspects of telepathy, talking about human consciousness, because, there's usually some sort of conspiracy theory, Da Vinci Code, it was, where's the Holy Grail, the cup of Christ. And then there's been ones on Freemasons and all sorts of things. But this one is about a cover-up about what we know about how the human brain works and its potential. So I thought you might like that one, George, because, we know so little about how the human brain works. And that's if we look at it in a traditional format. If we start looking at what could the brain be capable of and how the very nature of consciousness work, which we really have no idea. It's fascinating. So, yeah, let me know if you read that one. I thought you might like it because I know you don't often read novels as well. When we talk about books, they're always intellectual pursuits. So this is a bit of a mix.
I might wait for the Tom Hanks version on the movie. But look, you're right. I mean, I said I was at a forum during the week on dementia, and the reality is that our understanding of the brain is very, very nascent. I mean, it really is a complex organ. We're talking to some people around the dementia models around proteins and amyloid deployments, and there's just so many intricacies. So, look, you may have made me read my first novel for many, many years, Louise.
All right. Well, if you do, let me know. Hopefully you enjoy it. All right. Well, George, I look forward to seeing you next week in Canberra. But in the meantime, if you could please read us out for today.
Thank you all for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Emily Mara for her support. Big thanks to everyone for listening. Make sure you subscribe, follow and rate us wherever you get your podcasts. And don't forget, you can visit pulseit.news to sign up for the e-newsletter and explore Pulse IT's massive digital archive. Send any feedback or topic suggestions to pulsepod@pulseit.news. We'd love to hear what's on your mind. Thanks, everyone.
Thanks, George.